And in this video I'm going to show you how to give a gentle Indian head and shoulder massage. It can be carried out anywhere. All you need is an upright chair. You don't need to remove any clothes, and you don't need to use wax or oil because you'll be touching the head and the face. Ask the patient if they've got any issues with their neck or shoulder or head. If they do have any past injuries or any diseases, then ask a few more questions and judge whether it's safe to touch those areas or not. So for example, if they have arthritis in the spine, in the neck, then it may be the case that you don't want to work on those areas. You may avoid the neck, or if you do, you go very superficially. You don't go deep because you don't want to aggravate any problems they have. You don't want to make things worse. The same for injuries or any past surgeries. If there's any scars, you may want to just avoid those areas completely. Just explain, I'm going to avoid these areas, and work around them. Make sure your hands are warm. If you have cold hands, then just warm them up under a warm water tap for a few minutes before you get started. Always check with the patient on your pressure. If you're going too hard, ask them at the beginning to let you know. And to begin with, I usually like to just lay my hands on the shoulder and just ground myself and encourage the patient to ground themselves. At the same time, you're scanning the shoulders, you're feeling out for any tension, any hardness. When you're ready, just warm up the muscles in a circular motion using the flat of the palm of the hand, and just rub the muscles, warming them up and just letting them know that you're going to be working on them today. And you're working on the shoulder blades, all around the muscles in the spine. Very light rubbing, warming motion. And in this video I'm showing one side, one half of the body, but obviously you want to do both halves of the body. And the first motion when you're ready is this fanning butterfly motion, using your thumbs, pressing in with your thumbs, resting the hands on the shoulder blades and pressing inwards from the middle upwards and outwards in a kind of butterfly fanning motion with a bit of pressure. So you need to have a bit of thumb strength here, and don't worry if you don't have any strength at the beginning. When you first start doing this, over weeks or months of doing this, you will gradually get stronger and stronger. Now I do this motion when I come down from the base of the neck along the shoulder, pressing downwards, because this muscle area does tend to get very tight. And again, just going upwards in the fanning motion and then down from the back. And I work on this one acupuncture point. It's called gallbladder 21, and it's right at the top of the shoulders. And I just simply press into it. It's usually always tight in most people, especially if they have very tight shoulders. It's always the strongest point where there's a lot of tension. And then I stop rubbing into it in a circular motion, just releasing the tension, and then stop and then press and then just sink into it slowly. Then I work along the scapular spine. So find the scapula, and there's a bone, it comes out, and I'm going to be working on the inside of that area. It's always a bit of tension, it's always a bit sticky, where the muscles get a bit sticky there. And working upwards from the bottom in circular motions, using the tips of my fingers, just slowly, just gently, just massaging gradually up. Some people it's very well defined, in other people it's not so much. Also slightly push the arm back a little bit and it will define the spine a lot more clearly. And you're just going from the bottom upwards. I usually do it about twice. Just circular motion, and you're just kind of releasing some of the stickiness of the muscles there until you get to the top. And you're helping to release the shoulder blade as well by doing this. Now I do some more acupuncture points. This is a small intestine 9 point. I just go into it, just massage in a circular motion. It's basically I'm incorporating a bit of acupressure into this. This is not in the original Indian head and shoulder massage system, but as an acupuncturist I do use some of these points because I know they can be very good at helping to release the shoulders. Now another motion is this kind of pinching motion, and I do that on the upper arms. It's like you're kind of pulling the muscle away from the bone. And then another point is large intestine 11, and that's on the elbow crease, on the outer aspect of the elbow crease. You can't see it very clearly here, but again I just go into it and do a bit of acupressure, a circular motion, and then there's along one point which is on the anterior aspect of the chest, which I press and massage, but again you can't see it very clearly. So then you've done one side and then you go and do the other side, and again just working up the scapular spine from the bottom in a nice circular motion. Just keep going up, and if you find any little areas of tightness or stickiness, you can take a few moments just to kind of release and work on them. So again, the small intestine 9 points. Nice point to release the shoulders. Just press inwards, and again just that pinching motion down the top part of the arm. You're kind of separating the muscle from the bone. And then the large intestine 11 point. And just after doing that, just go back to the fanning butterfly motion, and then pressing on the shoulders again. Now we're going to be working on what's called the bladder channel in Chinese medicine, and these are the inner and outer bladder points. So there's two channels, two energy channels or meridians that go parallel down to the spine, down the back of the body, down the back, and there's an inner line and there's an outer line. I'm just going to be working on the inner line, and these points are basically just to the side adjacent to the spinal processes, and you're just going and just slowly pressing into them, not too hard, slowly sinking into the points. And now I'm just going to do a kind of a kneading kind of movement here, and using your hands, it's like kneading bread, just kneading the up part of the muscles. And by now they should be a little bit more relaxed, they should be a bit more released. Here I'm going on to the neck. So yes, if they have long hair, you can ask them to tie it up, or you can just avoid it, just move out of your way. This is you've got to be very gentle with the neck. It's a very delicate part of the body. Definitely don't use too much pressure. Don't go too hard. Slowly, gently squeezing it and releasing it, and coming outwards at the same time. Then there's this point called gallbladder 20, and it's just up at the base of the skull, in these two depressions, these two dips, and just give a gentle squeeze. It's very gentle, it's not going in very deep. Sort of slowly sink into it and just release. Working down the side of the muscles, there's sternocleidomastoid muscle, which is down the side of the neck. Just give it a gentle stroke, not too hard, just a nice gentle stroke. Both sides. After that we are going on to the head. We do this, I think it's called shampison. It's like a kind of shampooing the hair, but at the same time you're stroking into the scalp, you're releasing the tension in the muscles, and this can be very, very relaxing to people. You may find some areas of tension in some areas of the scalp. The muscles do contain a lot of tension. Just work on them. So continue to massage into the muscles on the scalp of the head. These muscles contain a lot of tension, as we use our brains a lot and we think and worry, and the tension collects in the muscles around the skull and the scalp. There are some really good points to massage that just go around the ear. So just slowly sink your fingers into them and massage them and press and release. Now it's good to work on the ears, but before you do, just check there aren't any earrings or devices like hearing aids in the ear. If there are, just avoid that part of the ear. And all you're doing is treating the rim of the ear, just a gentle squeeze and release, squeeze and release. Just go from top to bottom and then back up again. And then we do this little pitter-patter on the scalp. It's like little raindrops. It's very soft. And then a little rub. This is quite a nice acupuncture point to use, acupressure point. It's called TAIYANG. It's in the temple. And if someone has a headache, naturally they're drawn to massage this point on their own heads by themselves to help relieve it. So this is a good point for headaches. It's always good to get a cushion between you and the patient to rest their head on. And then also we do along the eyebrows. There's another point called YINTANG. It's a very calming point. It corresponds to the third eye in yoga. Just massage in a circular fashion. This is a sinus point called BITONG. It's in the nasolabial groove, just a little bit higher, and it's good for clearing the sinuses. Again, just gentle rotational kind of massage into it. The jaws is an area where we get a lot of tension. Some people have a lot of stress and they clench their teeth or they grind their teeth, and they'll have little hard points in the muscle here. So it's good just to help release that. But be mindful, some people don't want to be touched here, so it depends on whether you feel they're okay with it. And also just lay your hands over the ears, and it creates that kind of effect when you're listening to a seashell and you can hear the sound of the sea. It's very calming and relaxing. Now, when you come to the end, I incorporate a little bit of Reiki touch. I just lay my hands on the top of the scalp, and I'm not channeling energy or anything, I'm just simply laying my hands on, just being present, and then put one hand on the forehead and one hand on the back of the neck. A hand on the back and another hand on the shoulder. And then to finish, put both hands on the shoulders, which is the same as the very opening move that you do. So you've come full circle in your treatment. And then when you come to then, just encourage the patient to bring themselves back into the room and take a few moments and offer a glass of water if necessary. I'd just like to give thanks to my model, Flo Rido. She's a yoga teacher, artist and writer, and her website is www.spacetoflow.com.